Welcome back to Isa's Corner. Our next guest is Kelly Cybersma from PhotoniChealth.com. Come on in, Kelly.
Hi, thanks for having me.
Hi, nice to see you.
Hi.
So I'm sorry, you're not actually from PhotoniChealth.com. You're a Photonic Health representative.
I am, yes.
Sorry, I'll correct myself on that one. Wonderful. And so, Isa, welcome to you.
Hi, Isa.
Thanks for joining us. Isa would like you to begin by just explaining what Photonic Health is and what you provide as a service.
So, Photonic Health is all about empowerment of the individual. And so what we do is we actually sell the healthcare system, which in this case is a cold laser, and it's also referred to as a red light. And then we also sell with it the educational materials that you can use. So the red light does several things. It can stimulate your acupuncture and acupressure points. So we also sell with that books that you can use to refer to. It can stop bleeding because it brings collagen and serotonin and all the chemicals you need to stop the bleeding. So either internal bleeding, so it can prevent bruises, or external bleeding.
So are you basically providing this service, or are you selling this as an option for people to provide for themselves, for their own pets?
Both. So what we prefer to do is to provide you with the tool and provide you with the information to be able to do it yourself, so that whenever you need it, wherever you are, you have it with you. I keep mine on my belt almost all the time. But if you also have something very specific going on and you feel like you only want it for a short period of time, then there's a lot of representatives like myself that can come out and help you out for a short period of time.
So Isa's basically developing a health issue as we speak, so that we can demonstrate what you actually do. So you brought your laser with you.
I do.
And so just tell us a little bit about the laser as you can begin to show us how it works.
So the laser is actually in a military case housing because we used it around all types of animals. So for this, it makes it crush-proof and waterproof, so you can bring it to the barn if you have horses. And it also makes it more financially affordable because these are produced in bulk. So instead of paying for a big fancy system, you're just paying for what's inside of it. So all you do is first, I usually like to let the animal just smell it first before I have it even turned on. Let me see if they're interested. You got a little sniff. Got a lick. And again, like a lot of times horses will want to put it in their mouth and explore it that way, and that's totally fine. And then it just twists to turn on. It's battery operated.
And what type of a laser is it?
It's a cold laser, so it's completely safe, and that's why anybody at home can use it. You don't need to be trained specifically, because the worst thing it's going to do is not help if you put it on the wrong spot, but it won't cause any harm at all. So I try to find a really friendly spot to start with, and a lot of times you can find a friendly spot just along their back that's less invasive. So I usually start just by putting it back there, or with a horse you can do like their withers, anywhere around there.
And Isa's having some lung issues right at the moment, so basically if we can focus on that area when you're ready. He's quite accepting of that, definitely.
Yeah.
You can feel his breathing change already.
So instead of just kind of focusing in right away, it's really nice to just kind of say, hey, this is what it's going to feel like, because they're so sensitive, they can feel the energy of it. And then
So slowly approach in, so it's not overwhelming for them.
Yeah.
That's wonderful.
I'm starting to kind of breathe a little like shallow now. And some animals after this, they'll either get really sleepy, or some animals will get really excited. So it's really individual what the reaction will be afterwards for them.
That's interesting, depending on how it stimulates or calms them.
Yeah.
And to what degree does the laser go? What depth are we looking at? Is it a specific depth that's the concern? Is it affecting the cells? How is it working?
It's really depending on what your issue is. So when you're working with acupuncture and acupressure, this light is the way to go because it doesn't go as deep. And this light can also reach the bloodstream and not go past it. So it has antiviral properties for any virus in the bloodstream. We do have another light which goes a lot deeper, which if you have like a really deep tissue issue or a bone issue, then it's better to use the other one. For animals, you're usually fine with this light. This light's called the standard because they're much more sensitive. But for people, a lot of times when we have issues, we need the more powerful one because we're more stubborn.
Yeah, definitely. Well, he seems to be responding
Yeah.
very well to that.
So with dogs in general, especially with, I have a little dog as well, whenever anything comes up, I also like to just do his paws because that's where all of his meridians will end. And so if you hit the paw, it'll bring all the circulation all the way through, and any blocks, it'll help take them out. So if you'll let me, I'll find his paws.
I think he could pretty much do anything at
Yeah,
this
right
moment.
now.
You've relaxed him so greatly. We definitely need to get one of those.
Yeah.
Lisa's parents will have to make an investment, I think.
The really great thing about it is it's not at all a replacement for like a veterinarian, but for issues that, small issues that aren't as threatening, you can first see if you can fix it yourself.
Like a wound or...
Like a wound or something that doesn't need immediate veterinary, or even if it does, something that you can do while you're on your way to the veterinarian.
Oh, that's
And then
a
it
great
ends up
idea.
paying for itself. Like a lot of times if I'm having a horse that's colicking, I call my vet, but I also do the acupressure points
While
for
you're
a
waiting.
colic while I'm waiting. And a lot of times I could say, hey, never mind, and then in one trip you've paid for it. Right?
That's beautiful. Wonderful. Right, and you've worked with a lot of interesting cases.
Yeah.
And you've brought us some pictures of before and afters for us to look at, but can you describe some of the things that you've done, some of the wonderful stories that you have in helping animals with the laser?
Yeah, well, horses are my favorite because I was very skeptical of it when I first heard about it, and I find horses are the most honest, and their reactions are just so strong. So I had a personal incident where I took off the side of my face, and within 7 days it was all completely grown back, and all I had was antibiotics. I didn't do anything else that the doctor
How did you do
said.
that?
Just by red lighting 3 times a day for 10 minutes. And then I was sold. So then I started getting into it and using it more with the horses. And just, I've had horses where you hit a spot on their back that's just been blocked for so long, and they'll literally like drop and lay down right there and just roll and shake it out. Because what it's doing is it's releasing the muscles in the fascia so that it can self-align itself again.
That's brilliant.
Yeah.
Brilliant. So give us a little bit of a rundown about the pictures that you're going to show us. There's one with the skin issue, is that correct?
Yeah, so the first issue is a horse that got a skin issue, a bit of a rash, and then it turned into an infection.
Wonderful. So in this shot, basically, the skin, it shows the skin before and the skin
Skin
after. And
after.
how long was the therapy that you did? Do you remember?
I believe that therapy is 8 days. So that would be 8 days of treating it 1 or 2 times a day, just for basically as long as you like. Usually when it's a wound, there's no real rules about how long, so I usually would stay on it, 30 seconds a spot and then move it because the surface area it reaches is small. But usually in 30 seconds you've fully stimulated and you can move on to another spot.
Wonderful. And you can use it with other modalities as well, is that correct?
Yes, actually it's starting to get really big in a lot of the alternative therapies. So a lot of chiropractors are starting to use it before use because by releasing the muscles, the bones will often stay in place longer. Because a lot of times when we move the bones back, if the muscles are still stiff, the muscles can pull them out. So by releasing the muscles, and then also it can prevent some of the things you have to manually move. A lot of equine dentists are starting to use it because they're finding the hyoid bone in the horse. There's not really any other way to maneuver it because it's very breakable, and it's just a floating bone under their jaw. And it can also affect the TMJ and the way the teeth lay in the mouth. So a lot of equine dentists are starting to do what we call the hyoid points before to really get the mouth lined up before they do the teeth. Otherwise, if the muscles aren't all relaxed when they do the teeth, they're doing it to an already twisted jaw, and then they're not able to get a proper alignment. A lot of people who use essential oils, we usually red light and then apply the essential oils because the red light can push the essential oils in too deep if you do it the other way around.
Oh, that's interesting.
Yeah.
To know. Wonderful, wonderful. And you brought another picture with you to demonstrate how the laser works.
Yeah.
And what is that? Can you give us an explanation of that?
Yeah, so this is a horse that basically tore the inside of its mouth. It's called the labial in the mouth. And the picture is at the time of the injury. The picture is 2 days after the injury, and then the current state of the horse.
Wow, wonderful. That's great. So you've had some really amazing results with the laser. And basically, if anyone is interested in purchasing a laser for themselves, they can contact you personally? Is that how they go about it?
Yeah, you can order off the internet. It is a U.S. company though, so I always keep an inventory in Canada, and then I can ship from Canada and help save on some of the costs, because when I bring across, I'll bring across in bulk. So you can just put my information on the screen.
Yeah, we'll just have
Yeah.
that for people to be able to contact you for sure. That's wonderful. And if someone decides that they would like to have a test run of it, or have you come
Yeah.
because they're not confident in doing it themselves, you'll do that as well.
Absolutely, and just know that there's a 90-day money-back guarantee on all purchases. So the only people who, to my knowledge, have ever returned are ones that never tried it. So never took it out of the box after buying it.
Interesting.
But just in case, it's no questions asked, total money-back guarantee.
That's excellent.
Yeah.
Very good. And do you also provide some kind of seminars or teaching sessions for people? Do you have that option as well?
Absolutely. So I can travel around, and I'm certified in what's called level 1, and I can help share that knowledge. You can also now self-certify level 1 online, which is really great to know. There's also an introductory course for free online when you purchase a light. So we're really about getting the person to be able to learn about it and use it themselves at any time. So we have tons of resources for anyone who's interested.
And Isa is talking about, you mentioned working with a horse with colic, but what about working with an animal who has a dog who has digestive issues? And have you ever experienced that?
Absolutely. So I have a 15-year-old dog, and with age, his digestive system is no longer as strong. And so he's on a pretty strict diet, but occasionally if he eats something he shouldn't by accident, or even if he just gets nervous and his digestive system gets mixed up, actually happened earlier this week.
I guess that's why he's asking.
Yeah, we just, between my mom and I, will apply the red light all around his abdomen area and down the sides of his backbone. And again, we'll do his feet, and he'll usually then fall asleep for like 5 hours. And he'll sometimes wake up feeling great, and sometimes we'll do it one more time. He'll go to sleep for like 5 hours again, and then it's good. Yeah, and then it doesn't come up again for another couple months. So
Couple months.
we're very happy
Really?
with that.
That's great results.
Yeah.
Wonderful. Amazing. And Isa would like you to talk for a moment. He says he wants you to talk about how you worked on yourself with the laser, which is not necessarily a pet-related thing,
Yeah.
but he's fascinated by the story that you have about what happened to you, and he's wanting you to share that as well.
Yeah, so I have lots of stories, but the first one that I brought up was with my face. And when I went to the hospital, I didn't go till the next day because everyone was telling me I was going to have to get surgery, and I was like, no, I'm fine. So my parents finally convinced me to go the next morning, and they kind of just freaked me out, and I was out of country at the time, so I decided we would start driving home. We were in Florida with the horses, and we were supposed to be coming home anyway, so just in the car, I was red lighting my face, again, like 3 times a day for 10 minutes, and you could visually change. Every time my mom would turn around, she could see a change in my face. So I took pictures actually several times a day to see the progression, and it was amazing how it just closed in. And then after that, a few years later, I was again in the States, and I broke my ankle. The day I got there, so we decided again to come home because they were saying, surgery again. And when I came home, my aunt was the X-ray tech up here, and they're not supposed to disclose anything, but she pretty much hinted that it was going to need surgery, but I couldn't get in to see the surgeon for a week, so I just kept red lighting, and I was red lighting as soon as it happened. And when I saw the surgeon, he was so impressed with how my muscles were holding it in place. They had strengthened enough that I didn't have to get surgery, and furthermore, he was so impressed with the progress after the swelling went down that he never put me in a cast. And I had 2 fractures, and he let me stay in a splint so I could take it off every day and keep red lighting. And then after that all healed and I was in physiotherapy, my physiotherapist couldn't believe how fast I was back with full mobility.
So, did you work on humans first or animals? And he's also asking, what's your favorite animal story? So there's 2 different questions there.
I would say I probably started on horses, working with the horses. There's a horse assessment that we teach that you can also use on dogs that lets you check their general wellness. It's very similar to that like a vet or a chiropractor would use, and then you just red light your findings there. So I did a lot of that with my horses because I was working them pretty hard at the time and wanted to keep them in top condition. And now I'm getting more into the people side, but people are skeptical, so sometimes they don't let it help, whereas horses are always just really show you it's helping, and I get the satisfaction in knowing I'm helping, so.
Just through their reactions.
Yeah, I prefer, like, even if I'm doing a horse and they don't give me a reaction, I sometimes get impatient, because I'm like, I know it's really good, just show me.
And what are the signs of it feeling good? More so you've talked about, they relax, sometimes
Yeah.
they'll drop to the ground and they'll roll or they'll lay down and
Yeah.
their eyes will close, they'll go to sleep.
I've
What other
had,
things have you seen?
dogs will often just like stand really still, like put it there, don't move, and they'll show you, and also their breathing will change, and then horses I find the most fascinating, and they'll sometimes even stretch up into it or move, so you put it on the right spot if you're not quite on the right spot, and just lots of blinky eyes, lots of licking and chewing, yawning, that type of thing. Sometimes they'll shake to get something back in alignment. It's all those signs.
That's great. Well, Kelly, thank you very much for joining us. Isa feels much more relaxed now, and his breathing has changed to normal, so it's definitely having an impact on him in a positive way. So thanks again for joining us, and we will make sure that your information appears on the screen so everybody can enjoy the benefits of your laser as well.
Thank you for having me.
Wonderful. Wonderful. And we would like to thank all our special guests today, Dr. Michelle, Imka, and Kelly for joining us. And we'll see you next time on Isa's Corner.